Good evening, Dr. Ramesh, sir.
Good
Good
evening,
evening,
good
sir.
afternoon, ma'am.
Right, sir.
Yeah, ma'am.
Dr. Subhalakshmi there, sir?
Yeah, Shubhalakshmi will be joining from her center. She is not with me, but
Acha, acha.
yeah, she will be joining. Dr. Anupam will also be joining, ma'am.
Okay, right. Oh, sir is also joining. Very good.
Yeah.
Dr. Muruganathan, sir, also. I think we have, let me just see who will have joined from the participant.
Good afternoon, Manjula.
Sir, good afternoon, sir. Namaste. How are you,
Okay.
sir?
Yes, namaste. Can you
Good
send
afternoon,
me,
sir.
Yes, sir.
Krishna, can you send me the general delegate link for somebody wants to register and join?
Yes, sir. I
Not
will
for
only,
this.
I will WhatsApp to you.
Yeah, that WhatsApp I'll send to my group.
Yes, sir. Yes, sir. I'm
So
just
that,
now.
yeah.
Right now.
You can also write 30,000 I have registered. How much is registered?
40 plus, sir. 40,000 plus.
You write like this. We are very happy that 40,000 have already registered. Kindly register like that. You write so that I will be proudly presenting and circulating in among our all groups.
Yes, sir. I'm sent. Right now, I'm sending, sir.
Thanks, Manjula.
Actually, in the brochure, only registration link is there. So I will send that also. Additionally, also I will send. So our participants list, sir. Sir, you have no, sir. The list, Dr. Ramesh Agarwal, Team A, Team B, Team B, all entire list is with you. Okay.
Yeah, the list is with me, ma'am.
Yeah, yeah.
Muruganathan
A very good afternoon to all the doctors, quiz masters, and zonal winners to the first. A very good afternoon to all the doctors, quiz masters, and zonal winners to the first ever fever quiz competition. This is your host Lippy Goyal, your official host for the FeFCon 2022, the fifth annual national conference. The fifth annual national conference of Fever Foundation of India. We are immensely grateful for supporting us for 5 consecutive years. And now, to take you through the exciting quiz, I hand over the session to the quiz master. All the best to all the finalists.
Dr. Muruganathan, sir?
Yeah. So thank you very much. I think we already delayed. So we'll have now quiz masters on action. Before that, I'll also request Anupam to say one best of luck, and then quiz master can start the question. I think everything is set.
Yes.
Now we'll go ahead with a nice, interesting quiz. And of course, we are recording now, Manjula, so that
Yes, sir.
later on somebody can also see the quiz later on.
Yes, sir.
So I
Yes.
wish the function all success, and we are very happy and grateful and proud that we are organizing this program. I think more than 40,000 delegates will come, and these delegates also will have an opportunity to watch the quiz after the quiz program is over. We can play it when they come also. Thank you. Over to you, Manjula.
Yeah, thank you. RX event, please start the recording. Dr. Rampam, sir, over to you.
Thank you, Dr. Muruganathan, sir. It is indeed a pleasure and a privilege to have Dr. Muruganathan at the outset and bless all the participants as well as the quiz masters. So thank you, Dr. Muruganathan, sir. And for the benefit of the participants and audience, I hope they are aware. Dr. Muruganathan is a very senior member. He has been the past president of API, and it is his greatness that he is with us, and with each small endeavor that we have, he gives us a push, and we had his blessings at the outset. That is a great moment for all of us and Fever Foundation. He is an advisory board member out there, and he has already won and awarded an oration also through Fever Foundation. And Dr. Manjula, thank you for the quiz program, and it is great. Don't get perturbed by 40,000 people watching you, but it is a great event here. And
Recording in
unfortunately,
progress.
we could not have you for the physical meeting because of certain issues. But I am sure that you will all enjoy this quiz, which is going to be there. And I wish you all the best. Dr. Ramesh Agarwal, he is professor of medicine at Lady Harding Medical College, and Dr. Shubhlakshmi Margekar, she is also professor of medicine at Lady Harding Medical College, Delhi. Both of them will be the main persons who would take you forward from here. And with this, all the best once again to all of you. And back to Dr. Manjula. Dr. Ramesh, please.
Thank you very much, sir. I think somebody is there is a dual. Somebody is talking. Can you kindly keep yourself kind of, if you are having two devices, kindly disconnect one, and there are a lot of noise coming somebody from, because I don't want you to keep you muted because you have to speak, so you have to keep you unmuted. Now Dr. Ramesh Agarwal and Subbalakshmi madam, Dr. Muruganathan sir and Dr. Anupam sir, our final quiz juries, their decisions are final. Both of them will be watching, and there any event there are issues, there will be final. And our quiz masters are Dr. Ramesh Agarwal sir and Subha Lakshmi. So both of them are going to conduct the proceeding. Over to you, Dr. Ramesh sir.
Warm welcome to all the participants, and thank you, Fever Foundation, Dr. Muruganathan sir and Dr. Anupam sir, for this introduction and running this quiz. So at the beginning, let us make ourselves very familiar and clear with the rules and regulations. The foremost among these will be that at all the time your video should be on, so that we are able to see you and you are able to watch us. And please check again with your devices. One by one, I will be requesting you all to introduce yourself so that your audio is also audible to us, and the communication is one-to-one. So for the rules, we will have 3 rounds: round 1, round 2, and round 3. Now each participant will have an opportunity to listen to the question and answer. So in round one, what is going to happen is that we are going to, for example, Team A is Dr. Naveen. So Dr. Naveen, we will be giving you a question. I will be asking you a question, or the quiz masters will be asking you a question. And for that particular question, we will read the question, we will read the options, and then we will switch on the timer. You will have 20 seconds to answer that question. If you answer that question, say in 5 seconds or say 7 seconds, and you have to unmute yourself and speak. So you have to very sure that before the start of the question, you unmute yourself, because that will be the first and the last chance in that particular round for you. So you have to make sure that you are visible also, and you are unmuted also. So we will ask you the question, the timer will start. The moment you will answer it, the timer will stop, and then we will evaluate your answer. Meanwhile, while the timer will stop, the other participants will have the option to answer it, but they will answer that particular question in the chat box. So all the other participants can write their answer in the chat box, like you may answer A, B, C, or D, because every question will have four choices: A, B, C, or D. The other participants, apart from team A, to whom we will be directly asking the question, the other participants are required to, or they may wish to answer in the chat box. So if team A answers it correctly, the whole marks will go to the team A. But if team A doesn't answer it correctly, and if someone else from seven amongst you answers it correctly, but he will be evaluated who answers it for the fastest. So the correct and the fastest in the chat box will be evaluated, and he will be given half of those marks. Am I right, Dr. Manjula? That is for round one.
Yes, just to add that whoever answers correctly, we will be giving 5 marks, sir, bonus marks, irrespective of the time. They need only write A, B, C, D. They don't have to type the answer. That's it. They can say option A.
Yeah.
That's the only
So,
things.
yeah, so don't lose that opportunity to gain the
Get the
marks,
option.
because
Yeah.
yeah, so because that will be actually be deciding if someone does it wrong and you are able to pick those marks. So ultimately that is going to help you. So you must be alert for every question which is asked, and you must be prompt enough to write A, B, C, D in the chat box. That is apart from team A. Just say, the one to whom we ask the question, he is going to answer it after unmuting. The others are not going to answer it on the audio media. They have to write in the chat box. So this should be very clear. So this is for round one. Each participant will be given one question from team A. Then we will go to team B, team C, team D, team E, team F, team G, team H. So this will complete the round one. Yes, ma'am.
The only thing I think, RX event, you should tell us which email, which person they have to answer, because others need not see the answer. Should they write to the scorer, or should they write to whom should they write, so others will not be seeing their answers? Can you answer, RX events?
To scorer.
Yeah, please select the scorer to type in your answer. So only scorer will be seeing your answer. Your colleagues will not be seeing the answer. So select the scorer when you are answering in the chat box. So in the chat box, you select the scorer who is a host also. So you type in ABCD to get your bonus marks. Hope that is clear to you, right? If you put it anyone or anybody can say, and they can also are seeing that answer, and they will also be getting the bonus marks. So you will be losing the edge. So that's why, yes, select the scorer option. Yeah. Sorry, sir. Ramesh, sir. Please go
No,
ahead.
that was very important to inform these participants, ma'am. Otherwise, they would have answered in the whole of the chat.
Yeah.
So please note, all of the participants, that you have to particularly answer to the scorer. So that the same instructions will follow for the round two also. What I have mentioned for the round one will hold true for the round two also. That each participant from team A till team H will be asked one question, and the team to which we ask has to verbally, audibly, with video on, has to answer the question, and the others can write in the chat box and to the scorer. So the one who, if the team A or the team B falls, then the one who has answered in the chat box fastest and the correct will be awarded marks, 5 marks. So this is for round 1 and round 2. Then comes the round 3. Round 3 is again a very interesting round. Then here all the participants will have to participate simultaneously. It is not one by one. Please understand, all of the participants will be participating simultaneously. We will be giving you one question and the time will start. The one, but the out of you, the one who answers it correctly and rapidly or the fastest, you all have to answer in the chat box to the scorer. In this case, no one has to speak. The round 3, no one has to speak. Everyone has to write in the chat box. The one who writes it correctly and the fastest will be awarded full marks for that particular question. There is no option to pass on to the another team, because all of you will be simultaneously participating in this particular round 3. So I think these are the rules, and in case at the end of all the 3 rounds we find that there are participants amongst you who have got the equal marks and there is a tie, so we have got a tiebreaker round also. So I think these are the rules and regulations, ma'am. Anything which from your end you like to add?
No, sir. Everything is fine. That's very clear.
Okay.
Please
So I will
instruct them to keep the video on throughout, sir. If they lose, they are losing marks. We are minusing there, because some people are going off and on. Then there will be penalty if they go video off. Your video has to be on throughout the quiz. You cannot off your video.
Very, very clear instructions from both of you. Very good. Keep it up.
Yeah, thank you, sir.
So now I will request Dr. Shubhalakshmi ma'am to please get the introduction of all the participants so that we can formally begin the quiz. Dr. Shubhalakshmi ma'am.
Yeah, thank you, Ramesh sir, and thank you, Manjula ma'am, for this wonderful quiz. So let's start. Myself, Dr. Shubhalakshmi. So let's start with the participant team A, Dr. Naveen. Introduce yourself, please.
Good afternoon, everyone. Myself, Dr. Naveen Chaba. I am from Mahatma Gandhi Medical College, Jaipur, Rajasthan, and I am third year PG resident here.
Okay, wonderful. So all the best. Next,
Thank
going
you,
to Dr. Aditi. Introduce yourself, Dr. Aditi.
Aditi, you are unmute.
Good afternoon, everyone. This is Dr. Aditi Tongar from MMIMSR Mullana. I am a third year PG resident over here.
myself, Dr. Naveen Chaba. I am from Mahatma Gandhi
Thank you.
Yeah, I think someone is having two devices. Someone is having two devices. Can you please, somebody
From
has
RX events, madam. I think that is the recording that is playing. There is a lag from the audio, so that is the connecting. RX
something
events you have to
RX
see now.
event, you see why that echo is coming.
Yes, yes.
Yeah.
Okay. Welcome, Dr. Aditi, and all the best. So now moving to Dr. Aman.
Hi everyone. This is Dr. Aman from GMC Bhopal, third year PG resident in Department of Medicine.
Okay, welcome and all the best, Dr. Aman. Dr. Madhurima, Team D, Dr. Madhurima.
Yes, ma'am. This is Dr. Madhurima Datta from Silchar Medical College, Assam, third year resident.
Okay, all the best, Dr. Madhurima. Now, Team E, Dr. Sai Prastha.
Good afternoon. This is Dr. Sai Prasad from MGIMS Sevagram, Varda.
Okay, all the best, Dr. Sai. Team F, Dr. Siddharth.
Good afternoon, everyone. This is Dr. Siddharth from Bangalore Medical College, final year postgraduate.
Okay, all the best, Dr. Siddharth. Moving on to Team G, Dr. Tanvi. Unmute yourself, Dr. Tanvi. Yes.
Good afternoon, everyone. I'm Dr. Tanvi Yusuf, third year resident in internal medicine from Assam Medical College, Dibrugarh, Assam.
All the best, Dr. Tanvi. Team H, Dr. Vishnu. Sorry, Dr. Vishu. Vishnu. Yes.
Good afternoon, everyone. I am Dr. Vishnu, third year postgraduate from Coimbatore Medical College, Tamil Nadu.
Okay, welcome, Dr. Vishnu, and all the best to all the participants. Over to Dr. Ramesh, sir. Sir, unmute yourself.
Sorry for that. I think we are very clear with the rules and regulations, so we can just go ahead with the quiz. So my request is that in round one, only one team will be required to answer the particular question. So the rest of us can mute ourselves for the round one and two. That particular team to whom we will be addressing the question should unmute, and the rest of them should unmute. And in the round three, everyone should unmute so that there is no hesitancy, there is no time lag between muting and unmuting. So is it very clear? Okay. So I think Dr. Anupam sir, can we start? Dr. Muganathan sir, can we start?
Please go ahead. Yes, yes.
Okay. So Dr.
All the best to
Shubhalakshmi.
everybody.
Dr. Shubhalakshmi, you can take the round one, then I will take the round two.
Yes. So, Manjula ma'am, can we start now?
Yes, ma'am.
First team A is Dr. Naveen. So everyone else should be muted and Dr. Naveen to unmute himself. Yes, he has done that. So, ma'am, we can move with the first question. Round one, first question. So you have to answer it, Dr. Naveen. It is for you. Direct question for you.
Alex, even can you start?
Okay, so NDM1 stands for New Delhi metallo beta lactamase, an enzyme produced by bacteria like E. coli and Klebsiella pneumoniae that confers antibiotic resistance to a number of antibiotics. Which of the following antibiotic is not affected by this enzyme? Option A, cephalosporin. Option B, colistin. Option D, carbapenem. And option D is aminoglycoside. Your time starts now. Dr. Naveen?
B colistin, ma'am. Option.
Stop
Okay,
the
B call.
Stop the timer, please.
Timer to stop. Okay, so Dr. Naveen has given the answer colistin B, and the answer correct is also colistin. What's the correct answer? Computer ji, can we have the correct answer, please?
Yeah.
Answer B, colistin.
Okay, okay. Answer B is
Actually,
colistin.
I have some issue. Half question is not seen on my screen. So
Sorry?
half question is not seen on my screen. So can they readjust the screen?
Question is not being seen. You have to readjust. Have you take
Actually, okay, ma'am, done. It's
side by side you make, na?
yeah.
Yeah, that's now fine.
Yeah,
Yeah. Right,
fine. Thank you.
Right.
Okay, so Dr. Naveen has already given the correct answer, so it will not be moving. So yes,
yeah, no
this
bonus. No bonus.
yeah,
You're saying, right?
yeah, it will not be transferred or no bonus will be there. So it is an enzyme that makes the bacteria resistance to a broad range of beta lactam antibiotics. So you have correctly answered, Dr. Naveen. Moving on to the next question, Computer ji.
Dr. Aditi.
Yes, second team B is Dr. Aditi. You have to unmute yourself.
Yeah,
Yes. Some recording is...
we are getting a lot of echo. Is it from your end, I guess? I don't know. It is echoing. I think you are viewing the live streaming as in the same room and we are getting all echo. There is a delay. Something you have to do. Yes, since you are there, kindly do something. Even I think the... Is it from the audience or is it from the RX events? We are getting the echo and we are getting the delayed video. I think it is going live stream. We are able to hear that also. Okay, right.
I'll just check.
Yeah. Can we go to the second one? Is that okay? Yeah. Please share the second question.
Aditi, unmute yourself.
Yeah.
Yeah, Computer ji. Second question.
RX event, please share the second question.
Yes. So eosinophilic meningoencephalitis is caused by, is it acanthoamoeba? It is Naegleria? Is it angiostrongylosis? Or it is toxoplasma? Dr. Aditi, your time starts now.
Timer. RX events timer.
Start the timer, please.
Dr. Aditi, have you answered?
Yeah, B. Naegleria.
Okay. Stop the timer. Timer is to be stopped. Okay, and Computer Ji has given the correct answer also. So let's see from the RX event that who else has given it correctly in the chat box. Can we have that? So correct and answer here is eosinophilic meningoencephalitis is caused by angiostrongylosis. Answer timing has been stopped, right, ma'am? For the other participants as well?
Yes.
Okay. So other options were like acanthoamoeba. So it also causes CNS manifestation, but usually granulomatous type of infection or granulomatous type of lesions are seen. And in Naegleria, what was there? Second option, it also causes this thing, CNS infection, but primary meningoencephalitis is caused by this, not eosinophilic. And C, we have just seen. And for D, toxoplasma, it causes encephalitis. So this question has passed and we have to see whether any one of us has correctly answered and who has done that. We have to check that.
Yeah. RX event, can you, madam, can we, by the scorer telling, can we move or you want the people to give the answer or shall we move to the third and come back to the bonus points?
Yeah, sure, ma'am.
So, Yash, can we go to the third questions or you want
Yes,
to?
ma'am. Yes,
And
ma'am.
also somebody has to, scorer has to check who has answered correctly for the question number 2 and to give the bonus marks. RX events have to do that. Okay, so now
Yes, Computer ji. Yeah, we can move on to the next third question to team C, that is Dr. Aman.
Yes,
Yeah,
ma'am.
you unmute yourself. Your
Yes, ma'am.
question is, which one of the following is incorrect in pathogenesis of leprosy? Option A, the lesion in Yusuf phenomena have heavy parasitism with AFB and may be fatal. B, type 2 lepra reaction occur in lepromatous end of leprosy spectrum and present with erythema nodosum leprosum. C, type 1 lepra reaction are downgrading reaction and seldom present with nerve trunk involvement. And option D is Mycobacterium leprae cannot be cultivated in artificial medium and tissue culture. Your time starts now.
Ma'am, it is option C.
Okay. Computer just stop the timer. So Dr. Aman has given type answer type 1 lepra reaction are downgraded reaction and seldom present with nerve trunk involvement. What is the correct answer, Computer Ji? Can we know?
Which is incorrect.
So lepra-2 reaction occur in lepromatous end of leprosy spectrum and present with erythema nodosum leprosum. So this was incorrect.
All the participant, I'm sure, are answering in the chat box. As a scorer, taking care of that, is the scorer ready to tell us, or you want to tell us later, scorer? Can you tell who, or you can tell us at
Nobody has given the right answer.
Nobody has given the right answer. Okay, nobody gets the bonus marks. What about the question B? Anybody gave you the right answer? Second question. This is the third
Dr.
question.
Naveen.
Dr.
For
Naveen. Second,
Yeah.
not the first one, second one.
For second, the winner was Dr. Naveen.
Naveen. So Naveen had got the bonus. You kindly make it a note of this. So Naveen gets second question bonus answer. Then third question, nobody has answered
My
correctly,
third
right?
question, Dr. Manjula, I will just like to say, there is some problem probably. The marking by the computer G has been a little erroneous. The answer by Aman is correct.
Answer by
The
Aman is
answer
correct.
is
Okay.
C, yes, only type 1 lepra reaction. So he should get full marks for that.
Yeah. Please, scorer, give 10 marks to Dr. Aman.
While coding, probably it has gone, because obviously, see, all of you should understand, we make the questions, the question back comes, and then it is coded there. So we are keeping a check, so you should be satisfied. The answer by the candidate is correct in this sense.
Scorer, please enter that. Dr. Aman gets the 10 marks. Our jury has given, so it has correct. Okay. Is that right? Can you reply, scorer?
Dr. Ramesh, am I right?
You are absolutely right,
Is
sir.
okay?
That's what I was wondering. I was trying to call Dr. Manjula for that, but probably you have pitched in and solved the problem.
Yes, sir. Okay. Now, can we have the fourth question to Dr. Madhurima, right, ma'am?
Yes, fourth question will be to Dr. Madhurima, team D. Yes. Computer ji, can we have the question? Yes. So the question for Dr. Madhurima is autoimmune thrombocytopenia is the adverse effect of which of the following anti-tubercular drug? Option A, isoniazid. Option B, rifampin. Option C, pyrizinamide. Or option D, ethambutol. Your time starts now.
Isoniazid.
Okay, stop the timer, computer ji. Stop the timer, computer ji. So you have given the option A, isoniazid. Okay. So computer ji, can we have the correct answer, please? Computer ji, can we have the correct answer? This is what Dr. Madhurima has given. What is the correct answer?
Correct answer is B, actually.
Yes.
Correct answer is B.
So anyone else who has given this answer correctly, if then it has to be checked in the back end or in the chat box.
Correct answer is B. Yeah.
Yeah, correct answer is B. It is not A.
Ma'am, Dr. Tanvi has given the correct answer as B.
Okay, he gets the bonus marks. Thank you, Yash. Yeah. Can we move to the next one?
Some connectivity issue with Dr. Subbalakshmi.
Yeah, can you take over, sir?
Yes,
I
sure.
think power went off, I think.
Yeah,
Yeah.
yeah. Computer ji, can we have the next question for Team E, Dr. Sai Prasad Jananrathan? All set, Team E?
Yeah.
So you are unmuted, I believe, and your question is which one of the following treatment regimen is recommended in adults for treating brucellosis with Pedro Pons sign visible on X-ray? Your choice one, A choice, doxycycline, rifampin, and aminoglycoside for the initial 2 to 3 weeks, followed by 6 weeks of rifampin and doxycycline. Choice B, levofloxacin and prednisolone for initial 1 week, followed by 6 weeks of rifampin. Choice C, aminoglycoside and trimethoprim sulfamethoxazole for initial 3 weeks, followed by doxycycline for next 4 weeks. Choice D, methylprednisolone for initial 5 days, followed by aminoglycoside and doxycycline for the next 7 days. And your time starts now. Computer ji, time start kijiye.
The answer is option A.
Yeah.
Option A. So computer ji time lock kijiye, time band kijiye computer ji, stop the timer. So you have answered as option A, doxycycline, rifampin, and aminoglycoside. The other options were levofloxacin and prednisolone, aminoglycoside and trimethoprim, methylprednisolone, followed by aminoglycoside and doxycycline. So I think let us see what is the correct answer, then we can have a discussion over it. Computer ji, correct answer. Saying the correct answer is not. Please stop the timer. The correct answer is not what the computer ji is showing. The
Yes.
computer ji is, I
Wrong
think,
today. Some
wrong today.
virus.
Yes, sir.
Computer
So
answer is right, actually.
your answer is very much correct, Team E, as
I think.
you have said. And very interestingly, I think, ma'am, that the human brains have evolved over the computers today in FeFCon.
I know. I don't know. RX event, there is something wrong happening. Kindly check. Okay. Yeah.
So full marks to Team E. Team E has won and got the full 10 marks. So because the crux of the question was that doxycycline is the main thing which should be added in atypical organisms, especially brucellosis and infections like this. Anupam sir, can we have some more discussion on this question?
Brucella is not a very common disorder all over India, but yes, we have regions wherein you will have to suspect brucellosis. And it is not an easy thing to diagnose also. And I would compliment that when you don't see these diseases very often and still you know the management, that is very good. That is an important thing for all of us to know, because these will come less often. And brucella, obviously, most of the times you will see patients presenting to you with pyrexia of unknown origin, and that is the most difficult thing. And as Dr. Ramesh has already said, when you treat in atypical infections, you have to be very, very careful, because your routine cephalosporins and all those drugs would not be effective in these drugs. So you can, like a URI, COVID, everybody was using azithromycin, right, left, center. And similarly, for any drugs, you have amoxicillin, augmentin, or clavem, that is comoxiclav, that we are using for all ordinary infections. And at times, quinolones also, you will understand, you are using for LRTI, lower respiratory tract infections, but now with tuberculosis, we no longer want them to be used. And there are a whole lot of side effects also with even safe drugs like quinolones. So this is important to know about less common diseases, and that is why probably this question was kept for all of you. And I think all of you are doing well, because everybody is answering the questions, because these questions, the quiz has not been devised to make things tough for you. It has been devised to have questions from a panorama. And you people are 8 people out here. It is just like a rainbow for all of us also. And we want that, yes, all of you who are, because you have competed in the initial rounds and reached here, all of you deserve credit. And I think you are playing very well. And don't get disheartened if you don't get a single question wrong, because you have further rounds also. All the best again. And Dr. Ramesh, back to you. Dr. Shubhlakshmi has joined probably.
Yeah, Dr. Shubhalakshmi, please take over from this. Now the question will be for Team F.
Yeah, thank you, sir. So Team F, Dr. Siddharth, unmute yourself. Dr. Sai, please Mute yourself. Yeah. So Dr. Siddharth and Computer Ji, can we have the next question? Yes. So which one of the following statement is true regarding polymyositis? It is associated with option A. It is associated with other systemic disorder like SLE and rheumatoid arthritis. B. Glucocorticoids are the drug of choice. C. Aspiration from the muscle may show gram-positive cocci in pus. Or option D. Myositis antibody Jo1 is present, which is predictive of an increased risk of lung inflammation. Your time starts now. Computer Ji, start the timer.
Option D, myositis antibody Jo1 is present, which is predictive of increased risk of lung inflammation.
Okay, Computer Ji, stop the timer, please. Yeah, so Dr. Siddharth has given the option D, myositis antibody. Stop the timer, please. Yeah. So myositis antibody Jo1 is present, which is predictive of increased risk of lung inflammation. So let's see, Computer Ji, what is the correct answer? Option C is the correct answer. Again, I think it is not mentioned correctly. So option C is the correct answer. That is, aspiration from the muscle may show gram-positive cocci in pus. So this was the correct answer. Computer ji, please check if the other students have answered it correctly. So it was regarding pyomyositis. So pyomyositis, pus in the muscle. So inflammation of the muscle as well as there is pus. So if the aspiration from the muscle is done, then it may show gram-positive cocci in the pus. So this was the answer for this question. Moving on to the next question. Next question is for Dr. Tanvi, Team G. Yeah, she has unmuted herself. So Computer Ji, can we have the next question, please? So your question is, 22-year-old male presented with complaint of urethral discharge and dysuria. The patient subsequently developed pain in the bilateral knee joint, ankle joint, developed red eye. The patient gave a history of unprotected sexual intercourse few weeks back. Gram stain of urethral smear had neutrophil without evidence of gonococci. Urine culture was sterile. What is the appropriate treatment for the given disease? So option A, azithromycin 1 gram single dose plus 7 days doxycycline. Option B, clindamycin 600 milligram plus 7 days doxycycline. Option C, rifampicin 300 milligram plus amoxicillin 500 milligram BD for 7 days. Or option D, doxycycline plus nitrofurantoin 100 milligram BD for 7 days. Your time starts now.
Option A.
Option A. Okay. Computer ji, stop the timer. Dr. Tanvi has already given the answer. Option A, that is azithromycin 1 gram single dose plus 7 days doxycycline. So, okay, Dr. Tanvi, why have you chosen this answer? Can I know if you are comfortable? Okay, no problem.
This could be reactive arthritis from UTI.
Okay, okay. So, Computer ji, can we have the correct answer first?
Ma'am, the correct answer is A, azithromycin 1 gram single dose plus 7 days doxycycline.
Okay, okay. So, Dr. Tanvi, you have answered it correctly. So, the other option where clindamycin or rifampicin or nitrofurantoin were used, that were not correct. Actually, the combination of these two, azithromycin plus doxycycline, was the treatment to be given in this case. So, this question is all answered correctly, so will not be passed. Moving on to next team.
We have any who has got the last correct answer? The question had passed.
Okay. So last
Anybody?
question. Yeah.
Right, RX events.
Yes.
Sir.
That question had passed. Anybody got the fastest finger correct? Other teams.
Sir, that previous question also was the fastest finger was by Dr. Tanvi.
Ma'am, it was said that everyone will get marks instead, not only the fastest fingers.
Manjula ma'am, you're on mute, ma'am.
Yes, you have to tell us how many people have answered it correctly, not fastest.
Okay, ma'am.
You tell me previous question, whoever has answered it correctly. You come back, we will move ahead. Next, we will come back, check the answers. Whoever has answered it correctly will get bonus 5 marks. It's not fastest.
Excuse me, ma'am. Second question, then fastest, I think Dr. Nabin had got it. Please kindly check that also.
Yeah. I will check all the bonus marks. I will recheck once again, and we will come back to you because the data will be already recorded. So we will come back to you with the bonus marks. Please, RX event, check everyone who has answered correctly should get the marks. That was the instruction, and not the fastest. Okay, go back and check. So everyone, whoever is answered correctly, irrespective of the time, should be given the marks. Bonus. Yeah.
Okay, so
right. Move on to the next one.
else,
The bonus marks, they will come back to us. Yeah.
okay, so everyone else, please mute yourself. Dr. Siddharth also, mute yourself. Everyone else, please mute yourself. And Dr. Vishnu, this question is for Dr. Vishnu, Team H. Can we have the question, please, Dr. Computer Ji? So identify the incorrect statement. Option A, live attenuated vaccine comprises weakened version of the pathogen. Option B, live attenuated vaccine contains adjuvant which enhances the magnitude and modulate the quality of the immune response. Option C, live attenuated vaccine confer immunity that lasts for several decades with even a single immunization. And or option D, live attenuated vaccine are not recommended for immunocompromised people. So your time starts now. Dr. Vishnu.
Option C, ma'am.
Option
B.
B. So computer G, please stop the timer. So you have given the option B,
C,
live
ma'am.
attenuated. Yeah.
Sir.
Option
C, ma'am. C.
C. Okay. So Dr. Vishnu has given the option C, live attenuated vaccine confers immunity that lasts for several uh, decades with even a single immunization. So computer G, can we have the correct answer, please? Okay, so the correct answer for this question was option B, that is live attenuated vaccine contains adjuvants which enhance the magnitude and modulate the quality of immune response. So this was the incorrect statement. Rest all the three, like live attenuated vaccine comprises weakened version of the pathogen and live attenuated vaccine are not recommended for immunocompromised people. These were all correct and the B option was incorrect. So computer G, you have to again check that if any other student have answered it correctly. So with
Yes, ma'am.
okay, so Manjula ma'am, we will have this.
Please, we will tell. Please give us the score before go to the second round, right, ma'am? Or what you are saying, ma'am?
Yeah, that ways also. So with this question, we have come to the end of round first, where we have given direct question, two question to sorry, one question to each participant. So that was it for the round first. So ma'am, we can have the score, please, for this round one.
I think the round had been very interesting that only 3 of the participants remained unsuccessful in answering in their attempt, and most of the candidates were able to answer it in the specified time. And then those 3 participants had an equal opportunity then to answer for the pass on questions. So I think there was a very great opportunity for them to score equally. Now the scoreboard would actually tell who's leading this round one. Sir, your comments, sir, Dr. Anupam, sir, about round one? Dr. Anupam, sir. Your comments, sir. Anything about round one, sir? How did it go?
We already said that yes, everybody is quite knowledgeable,
Correct,
and that is
even
why
they
they are here and
suggesting.
they are participating
Sir,
also.
madam,
And I think,
yeah, can we start the
uh,
second round? Afterwards, they'll come back to us
okay,
again.
okay, okay. So over to you, Dr. Ramesh. Take up the
Yeah.
second round now.
Thank you, sir. Thank you.
Best wishes again for the second round, all of you.
So thank you, sir. So the round second will have again the same rules which was there for round one. So every participant has to mute themselves except the team to which we will ask the question. So let us start with the second round. It will be an interesting round based mainly on the clinical questions. Team A, Dr. Naveen, I will be putting the question directly to you, and you should unmute yourself, Dr. Naveen. Yeah, can we have the question, computer ji? Dr. Naveen is ready. Dr. Naveen has answered fairly well in the round one. Let us see, Dr. Naveen, how you go about in round two. So this is a question on your screen, Dr. Naveen. 54 years male is admitted with pneumonia and diarrhea. The sputum staining revealed numerous neutrophils without any particular organism, and the blood investigations revealed hyponatremia and deranged liver function test. Chest X-ray showed patchy alveolar infiltrates with round opacities as shown in the image, which is shown in your screen. And there was no response to the treatment with beta-lactam antibiotics. What is the most likely cause of the pneumonia? And your choices are choice A, pneumococcus, choice B, salmonella, choice C is legionella, and choice D is E. coli. Computer ji, please start the timer.
Answer C, Legionella.
Computer ji, timer should be stopped. So the answer from Dr. Naveen is legionella. Dr. Naveen, it is actually a clinical based question, and some features had been there in the question itself, which probably gives a vital clue. So, do you think you are right in this question, Naveen? You have
Yes,
answered
sir.
this correctly. Okay. Oh, very interesting. So let us have the answer first. Computer ji, what is the correct answer? So Computer ji is not with us today. Computer ji, correct answer is? Computer ji, you can speak. No, that is not the correct answer,
No,
Computer
the
ji.
correct answer is correct. Naveen is correct, actually.
So Naveen, you are doing fairly well.
Computer ji, please don't show you're doing all complete. Please tell us verbally. You are doing all wrong answers. Please tell us verbally.
All right.
All are wrong. I think there is some coding error in your that has happened in your system.
Ma'am, it is trying to confuse our brilliant students.
Exactly.
Yeah.
But I am telling the computer ji, but rapid fire, you should be perfect.
So Naveen, there have been some very important clues in the question, like hyponatremia and the atypical shadows in the this X-ray, and of course the organism is Legionella. You are very right. Thank you, Naveen. So let us go to Team B, Dr. Aditi.
Yes, sir.
Dr. Aditi. Yeah, Dr. Aditi, you are ready. You are unmuted also. So, Computer ji, can we have the second question for Dr. Aditi? Computer ji, second question, question number 2 for Dr. Aditi. Yeah, Dr. Aditi, the question is the organism shown in the figure can cause large cysts in the liver. So you have to think which one of the following drugs is effective against this organism. Your choices are choice A is metronidazole, choice B is mebendazole, choice C is doxycycline, and choice D is azithromycin. Your time starts now. Computer ji timer start कीजिए.
Sir, A, metronidazole.
Computer ji, please stop the timer. So Aditi has answered it as metronidazole. Aditi, metronidazoles are generally used for amoebiasis, giardiasis, as we all know. And there are many other close choices like doxycycline and azithromycin. So the whole crux of this question will depend on what this organism is and what actually you have suspected out of this. So first, let us have the correct answer, Computer G. And please speak, Computer G. Don't click it
So
on
the
this.
correct answer is B, mebendazole.
So the correct answer, Aditi, is mebendazole, not metronidazole. They were very close choices, as the organism which is shown here is a parasite, and probably the question is talking about hydrated cyst. So for flukes like this, the treatment of choice will remain as antihelminthic, which is in mebendazole. So, Computerji, some of the participants must have answered it correctly. Please note them in your scoring board and share it with Dr. Manjula.
Yeah.
Yes, sir.
Yeah. Yeah.
Yes.
Okay.
So that was an interesting question, I think. Let us move to question number 3, and this will be to Team C, Dr. Aman.
Yes, sir.
So our metal head is ready. I think metal head or stone head, Dr. Aman. So let us have the question 3. Your question is, which one of the following statement is true for diagnosis and management of the clinical condition which is shown in figure? So this is the figure which is shown over here, and the choices are, choice A is that urine sample from this patient should be centrifuged for isolation of adult organism. Choice B is that Knott's concentration technique should not be applied for this patient as it will destroy the organism. The choice C is that Doppler of the affected area may differentiate live from dead organism. And choice D is that cryptic infection may be detected by assays for circulating antigen. Your time starts now. Be careful that the answer you have to is that it should be true and not false. Yeah, timer.
Sir, I feel that this is option D. Option D.
D for Delhi. D for
Delhi.
Delhi.
D for Delhi.
Computer ji, timer should be stopped. Lock kar diya jaye. So Dr. Aman has taken the answer as cryptic infection may be detected by assays for circulating antigen. There are also many other options, Aman.
Yes, sir.
But you have logged it into D. Okay. So Computer ji, what is the correct answer for this?
So the correct answer is C, Doppler of affected area may differentiate live from dead organisms.
Yeah. So Aman, actually the Doppler of the affected area, it differentiates a live from a dead organism. It is said that on Doppler there is a filarial dance sign which identifies the live worms, and the body fluids are used for diagnosis of microfilaria and not adult worms. So the choice is becomes wrong by itself.
Okay.
So this probably question is taken from your Harrison Principles of Medicine. It is always an opportunity to go back and revise our basic. Computer ji, please see that who has answered this correctly, and the same may be scored and shared with Dr. Manjula. Yeah, so next question we can have with team D. Dr. Madhurima, are you all ready? Dr. Madhurima is with me.
Yes,
Yeah,
sir.
so she is unmuted also. Computer ji, can we have the next question? So this is the question that a 12-year boy comes to you and he developed a painful brownish raised lesion over the back of his left leg, as you can see in that figure, which is associated with surrounding redness. And this happened 1 week after returning from a forest camp. The diagnosis was confirmed by biopsy report, and it showed microorganisms when it was stained with Warthin steri stain. So what do you think is the most appropriate treatment? Your choice A is doxycycline. Your choice B is amikacin. Choice C is metronidazole. Choice D is ciprofloxacin. Computer ji, timer. Computer ji, please stop the timer. Madhurima has answered it as A, doxycycline. Okay, Madhurima, the choices were again very close as we had in the initial first question. They are all of them are antibiotics, and one of them has to be correct. So, any clue, Madhurima? What are we suspecting in this particular case?
The scrub typhus.
Okay, so that is one. Anything else? But scrub doesn't stain with Warthin Steri stain. So let us have the correct answer first and congratulate, if at all, Madhurima. Computer ji, what is the correct answer?
So the correct answer is A, doxycycline.
So, Madhurima, it should have been smile to your face. So the answer is very much correct. The organism responsible was a spirochete, and the lesion which is shown here is the erythema migrans, erythema chronicum migrans. The antibiotic of choice, as Dr. Anupam said it rightly, is doxycycline, which really works for many of the atypical problems. So, but anyway, the question is correct, and we will award you fully for this question. So, Computer ji, can we have the next team? Now, the team is Team E, Dr. Sai Prasad. Dr. Sai Prasad, you have to unmute yourself. Yeah, am I pronouncing your name correctly, Dr. Sai Prasad?
So actually, my name is Sai Prasad.
Yeah, so that's why I again wanted to ensure that I at least pronounce your name correctly. So, Dr. Sai Prasad, this question is for you. Computer ji, can we have the next question? Question from a basic medical sciences, Sai Prasad ji. So the question is, what type of fever pattern is shown here? The diagram is visible over there on your screen. The choice A is it remittent fever? The choice B, is it intermittent fever? Choice C, is it continuous fever? Or choice D is relapsing fever? So your time starts now, Dr. Sai Prasad. Computer ji.
It is option A, remittent fever.
Lock, timer should be stopped. So Dr. Sai Prasad has answered it as remittent fever. And the question is from the very basic clinical medicine. And this particular type of chart we all see in our day-to-day practice in the medical wards. And this particular graph itself gives us a vital clue that what disease probably the patient may be suffering from or the patient may not be suffering from. So, can Dr. Sai Prasad, can you share with your knowledge that what can be the examples of the remittent fever or intermittent fever? I'm not taking your viva voce. If you're comfortable, you can answer.
Maybe.
Okay, so the examples of remittent fever are, of course, like the enteric fever, which is a step-like pattern of a fever. Intermittent fevers are present in malarias. Continuous fever can be there in pneumonias or any other viral fever. Relapsing fever, we all know about the borrelias. So, what is the correct answer, Computer ji?
So the correct answer.
Yeah. Madam, please go ahead, ma'am.
Okay, so the correct answer for this question was remittent fever, and Dr. Sai has very correctly answered. And sir, you have also very much explained the answer as well as the examples also. So congratulations, Dr. Sai.
Congratulations, Dr. Sai. So, very basic sciences, but the idea of putting this question was that this one type of question will never leave you, whether you do your MBBS or MDs or you go to your DMs. So with this, let us come to Team G. Dr. Tanvi, are you ready? Dr. Tanvi. Yeah,
Ready.
she is ready. Yeah, and she is unmuted also. Computer Ji, can we have the next question? So the question is, a 32-year male came with pain abdomen and fever for the last 2 weeks. On examination, he was febrile and had tachycardia. CT of the abdomen showed a 200 cc volume lesion in the right lobe of liver. And he was started with some antibiotic like metronidazole, 500 milligram 3 times a day, but his condition did not improve even after 7 days of therapy. So which one of the following statement is most appropriate? for further management of this patient. Your choice A is that the lesion should be aspirated and antibiotics may be continued. Your choice B is that you go for a surgical excision along with chemotherapy should be planned for this patient. Choice C is that antibiotics should be stopped and patient should go for further investigations like PET-CT scan. Choice D is that patient should be reassured and same treatment can be continued. And your time starts now.
Is it B?
So please stop the timer, computer ji. So Tanvi has gone for a surgical excision of the lesion because probably she thought that the patient is not responding to your medical treatment. Yes, Dr.
I'm
Tanvi,
confused, but can I change my answer, sir?
that Dr. Manjula will have to decide.
No,
No,
sir,
you are.
it can't be changed.
No, it can't be. So it doesn't matter. It is a learning exercise. So let me explain whether you are correct or whether you are wrong. So why do you want to change first? You tell me.
It could be A, the lesion should be aspirated. We should send for a culture and continue the same antibiotic until we receive culture reports. But since his condition is not improving on metronidazole, that's why maybe surgical excision should be planned.
But Tanvi, don't you think that when we aspirate, it is something more than we do send for a culture? We aspirate and decrease the volume of the abscess. It's not only that we are sending it for culture. So probably it is less than a surgical treatment, but actually that helps the patient, especially in those abscesses which are, say, of this volume, and of course, which are there in the left lobe of the liver. So in there we go an only decision for aspiration of the abscesses. So I think the answer is very clear from what I have discussed. Computer ji, what is the correct answer?
I will be answering, sir.
No,
So
the Yash
again,
can answer. Yeah, computer can answer now, I think. Do they?
okay,
Can
okay.
they? Can they?
Yes, ma'am. Ma'am,
Yeah.
the correct answer is option A. The lesion should be aspirated and antibiotics may be continued.
Answer is A, Tanvi. Dr. Shubhalakshmi, you want to add something to this? Because these things we routinely see in our wards and residents are well trained to
Yes.
do this activity. Yeah.
Yeah. Again, this one we have to check that the dose of the antibiotic what we are giving. Second thing, left lobe, as it is mentioned. So left lobe, again, we should be more vigilant if we are dealing with abscess, which is in the left lobe, and that too of 200 cc and not responding. So very correctly, you have explained that why we have to go for option A, because decompression is also very important.
Yeah, that's true, Dr. Shubhalakshmi. And if the patient is not responding, patient is becoming toxic, then that becomes an indication for aspiration. So thank you, Dr. Tanvi. And let us move to team H, Dr. Vishnu. So Dr. Vishnu is with us and he is muted and now is
Excuse me,
unmuted.
Sir, I think you missed Dr. Siddharth.
Yes,
Instead
sir.
of that, you went to Tanvi.
Okay.
So, scorer,
Yeah.
please make a note that the last question was for Tanvi. And so when you're marking also, you should mark the same way. Now, what do you want to
Dr.
do, sir?
Siddharth. Dr. Siddharth.
You will go to Dr. Siddharth? Yeah, Dr.
Yeah.
Siddharth for you. Yeah.
That was my mistake, Dr. Siddharth. So that's why you came and pitched in that you were left. Okay. Okay, so maybe you might be lucky for the next question. Probably you might have missed that question, which Tanvi did it wrong. Okay, Siddharth. So the question for you is, computer ji, can we have the next question for Dr. Siddharth? So the question is, a 64-year-old male, farmer by occupation with history of diabetes mellitus for 20 years, presented to the hospital with complaints of fever for 2 weeks. Physical examination revealed tenderness in the left foot with abscess formation, and MRI was suggestive of osteomyelitis. A previously performed blood culture showed pseudomonas, and he was treated with amikacin. However, his symptoms did not improve. So which of the following statements is true regarding this disease? The organism, A choice, the organism shows characteristic safety pin appearance on gram staining. Choice B, this disease is also known as Whitmore's disease. Choice C, the drug of choice is IV ceftazidime. And choice D, all the options are correct. So your timer starts now.
So option D, all of the above.
So please, timer should stop. So Dr. Siddharth has taken the option that all the options are correct. Anything in particular, Siddharth, in your mind, what this patient may be suffering from?
Not sure, sir, but he has not responded with amikacin.
So choice C seems to be correct amongst them. Okay. So that's how you actually try to take the question. Okay. And what about choice A?
Say a characteristic safety pin appearance.
This is okay. So computer ji, can we have the right answer first?
So the right answer is option D, all of the above.
So Siddharth, congratulations to you that you have answered it very correctly. So let me explain the other choices so that for the benefit of the other participants, that the disease which is being talked of here is the melioidosis, and melioidosis is a great mimicker. It's a condition by gram-negative bacteria, which is known as Burgholderia pseudomallei, which was also known as Pseudomonas pseudomallei previously. And this shows a characteristic safety pin appearance on gram staining. And this particular organism is particularly present in all types of soil, particularly damp and wet soils and agricultural lands. And since it's a Pseudomonas infection, we all know the antibiotic of choice, ceftazidime, is going to work. So you have answered it correctly. Congratulations. So can we move to the team H, Dr. Vishnu, who is the last participant of round 2? Dr. Vishnu, you are ready and you are unmuted. Computer ji, can we have the last question of round 2? So the question is on your screen. A 21-year male was brought by his family in shock with a non-blanching petechial rash all over the body. Kernick sign was present. CSF showed gram-negative diplococci. Which one of the following medications is the most preferred prophylactic therapy for his 7-month pregnant wife? The choice A, you want to give ceftriaxone 1 gram IM single dose to her. You want to give choice B, ciprofloxacin 500 milligram orally as a single dose. Choice C, rifampicin 600 milligram twice daily for 2 days. And choice D, amoxicillin 500 milligram thrice daily for 2 days. Computer ji, please start the timer.
Option C.
Computer ji, please stop the timer. So Vishnu has gone for choice C. Vishnu, let us first see the correct answer and then we can discuss the question. What is the correct answer, computer ji?
So the correct answer is option A, ceftriaxone 1 mg.
1 gram intramuscular single dose. So actually the question was a little tricky one, that it had 2 riders in it. That one is the most preferred one. It is not asking which can be given. And the second one was that it's for the 7-month pregnant lady. So even for a 7-month pregnant lady, the drug of choice, which is very safe, is ceftriaxone as compared to rifampicin. And the question is from a standard textbook of medicine, so there is no dichotomy or any double answers for this. So Vishnu, you were close to this answering to this question correctly, but the correct answer is that you have to inject an IM injection to her, ceftriaxone 1 gram IM as a prophylactic dose for this lady. Some people must have answered this correctly in the chat box. So Computer ji, please take the note of them and hand over it to Dr. Manjula.
Yes, sir.
So with this, we come to the end of this interesting second round, and the third round will be a rapid fire round, and the most rapid and the fast person, Dr. Anupam, is with us, who will take this round. Dr. Anupam, sir, please.
Dr. Ghansham is probably there. If Dr. Ghansham is there, he can continue with the round, the rapid fire round. He is the most versatile person among us.
Sir, I'm still traveling, sir. I cannot
So you are
take it.
still.
I will just.
I just saw
to-
you, so I thought
Sure.
that if you can continue. Dr. Ghansham has been instrumental in making these questions, and he has been an integral part of the quiz team. But instantly, see, he is in flight, probably he's traveling somewhere. So thank you, Dr. Ghansham, for joining. And so we will go ahead with the third round. And this is the last chance that we all have. And once again, best wishes. So all of you are ready. So all of you are to be muted, and you will type the questions, the answers to the questions on the chat box. Okay, na? Right?
Have you all understood, sir, what sir said, which was already told to you before also, that now everyone is going to answer, and here fastest finger only will get whoever answers correctly fast will get the points. No bonus marks, nothing is there. So fastest finger first. So everyone just in the chat box, you type A, B, C, D only, not the full answer. That's it. Only is it option A, option B, option C, option C, and write it to the scorer. Please write to the scorer, not to everyone. So then you will be right, sir. Anupam, sir. Anything else, sir?
That's absolutely fine. And this is your chance to
add scores
ahead of everybody, because you have simple questions, straightforward, and you have the choice to answer it. So just try to be correct as far as you can. Chalo, all the best, and we start with the questions.
Sir,
Computer ji.
I have a doubt. Is there any negative marking?
Yes, please.
No negative. Sir, is there a negative marking? He's asking.
No, there is no negative marking.
Yeah.
But you still have 25% chance of being correct. 1 out of 4. So you have 4 choices. 1 is correct. So you can ask. Computer ji, can we proceed? Yes. So the question is, minimum age for vaccination for TY21A, the typhoid vaccine, is choice A, 1 year, choice B, 2 years, choice C, 4 years, choice D, 6 years. And your time begins now.
Timer.
Timer is on, yes.
Yeah, but no sound.
हाँ.
Timer sound हटा गया है. Timer sound, please.
So you have only 7 more seconds. Those who have yet not attempted can attempt. Well, your time is over. So Computer ji, this is the oral typhoid vaccine. The typhoid vaccine, the minimum age that you give is, Computer ji, can we have the right answer? The correct answer is yes, D. Very nice. So this is not recommended for children less than 6 years of age, but yes, you can give it to all adults otherwise, and for children who are above 6 years of age. So typhoid vaccination is not very commonly given to everybody, recommended, but yes, it is important that we immunize patients against typhoid. There are some issues, but I am not going to the details of those issues, why typhoid vaccine is not being given, because I see that we have already crossed 3:30. And if time will permit, when we compile the results, I will just note down, we will talk about typhoid vaccination just for the benefit of the audience. So Computer ji, can we go to the next question?
Are they going to tell us the scorers? Are they going to tell, or are you taking time? RX event, somebody has to answer.
If we can have the answer, that would be great, because the participants would like to know.
Correct. Anybody from RX
if they are
event?
taking time, we can talk about typhoid vaccination. See, there are problems with typhoid vaccination. It is not a lifetime immunization as was being talked about with live vaccinations, live attenuated vaccinations. And these are vaccines which give you a protection for 3 to 5 years. So it is just like influenza vaccine, which has to be given every year. These vaccinations also have to be repeated after a period of time. And more important than vaccination, at times when you see from the community health perspective, although Dr. Sudarshan is here, he is a better person than me and more competent also to answer on this and talk about this. But the emphasis has to be on safe and wholesome, or what we call as potable water. Because if you have a hygienic and potable water, then you will never catch any of the enteric diseases, let alone typhoid. But all waterborne diseases you can get rid of if you have safe water supply and you practice good hygiene practices like washing your hands before your meals, not eating anything from the roadside which already has some flies sitting on it. So these are things which you take from measures. These are preventive measures and a basic part of our hygiene and sanitation practices. And these are important for typhoid also and for all other enteric diseases, including for at least polio also, which is considered to be transmitted by the orophycal route. So this is very important from all of us. So can we go back to the scorer and have the answer? Who is the winner for this question?
Yes, are they able to tell us? I think they should tell us. Yes, RX, when somebody, one of you have to speak, otherwise we won't know.
For typhoid, we have inactivated vaccine also. We have oral typhoid vaccine also. And the inactivated vaccine that I'm talking about is 3 to 5 years, which you have. The oral typhoid vaccine can be given as a capsule, 3 doses. And but the efficacy for all these vaccinations, one thing which I didn't touch about is hardly 60%. So you give protection or confer protection even after vaccination, that is to the tune of only 60%. And mind you, the injectable vaccine, they have to be 2 doses which have to be given, and they are very painful. And at times you can have febrile reactions after that vaccine is given. That is why actually it is not given ordinarily to everyone, and that is why they are not part of a health program that we have. So I think back to the scorer, or otherwise I will be taking a lecture out here.
Yes, since you are there, can you tell us, are they able to tell us, or should we move ahead? Because we
We
don't
move to
want
the
to
next
waste the
question
time.
otherwise.
Yeah, then give us the consolidated. Please, RX event, you should speak.
Ma'am, kindly go ahead.
Then you should give us a consolidated Excel sheet. Please make it ready.
Okay, ma'am. We are
Please
making
don't,
that.
but it should not be taken so much time. I think kindly do it fast, and then we will go ahead, and they are going to give us at the end, sir. Dr.
So we move to
Anupam,
the
sir,
next
please go ahead.
question of the rapid fire round. So the question was rapid fire, but the discussion was long. Sorry for that. Next question. So yes, the question is interferon gamma release assay measures interferon release against which mycobacterial tuberculosis antigen. So you have A choice ESAT6, B choice ESAT7, C CF11, and D CF12. Your time begins now. Pretty straightforward question, not much to think about in this. So your time is over. So the choices have been logged for whatever you have written. So you have the choices, RX events. So this is basically, so you have given the choice correct answer ESAT6, but we have to see who got the correct answer, but we will not wait. Uh, Computer ji, next question pe chale. Shall we move to the next question? Pontiac fever is caused by, you have choices, choice A, Marburg, B, Legionella, C, tuberculosis bacilli, and D, synth-based virus. Your time begins now.
Timer, please.
Computer ji has given you some extra time for this. No issues. So, can we have the right answer? Legionella. So the correct answer is Legionella. So we already had one question about Legionella, and this is again you have descriptions for these atypical infections. You have other atypical infections also like Mycobacterium other than tubercle bacilli and the Ebola Marburg virus also. These are all atypical viruses and not commonly seen. But of all the atypical infections, I would say chlamydia, legionella, they are important because they will not be treated by the ordinary antibiotics that we use. So, computer ji, next question. Let us move to the next question. So, this question, tuberculosis affects which bone more frequently? Number A, spine. Number B, metaphysis of long bones. C, the ribs. And D, the sternum. So, your time begins now. Timer. These questions are made pretty straightforward for you all because they were part of rapid fire rounds. So you have to answer quickly. Your time is over. Thank you. And tuberculosis, obviously, we all understand the choices given here are a lot, but sternum is one of the bones which is considered to be the most resistant bones. And similarly, ribs also, unless until a cold abscess tracks down the spine. And long bones, yes, you may have some involvement, tuberculosis of the femur, but they are all less. The commonest answer probably, what is the correct answer, computer ji, before I give the explanation? They should not prove, computer ji should not prove me wrong. Yes, so the spine, that is the commonest bone which is actually involved, and you will see Pott's spine, you have tuberculosis involvement, and you have spine and spinal cord involvement. You see very frequently epidural abscess, all those conditions which are actually common and which in our country are quite frequently seen also. We have a tuberculosis control program also, and now DOTS therapy and incentive for patients who are taking treatment. The government has ensured so that they comply with ATT. Well, of that apart, we move to the last question, the fifth question. Computer ji, can we have this question? Next question. Latent varicella zoster infection is found in A, T cells, B is B cells, C is macrophages, and D is trigeminal ganglion. So your time begins now. Time is over. Can we have the correct answer? So I hope all of you have attempted, and we come to end of this. I am sure that it would have been an interesting participation. And computer ji, now we will require the results for all. The Excel sheet, Dr. Banjula, we will require. So again, congrats to all for participation. The results are a secondary thing, although I know all of you will be eagerly waiting for it. But yes, it is important for all of you to understand that you have reached a level and you have participated in this competition in the finals of this quiz. And apart from the fact that you have initially we planned to have you all physically, but because of a number of reasons, we could not manage that. So again, congratulations for participation, and the results till the time we have. Dr. Ramesh, Dr. Shubhlakshmi, they will like to say anything, add to the for the confidence of the participants.
Yes, sir, very well said, because participation is very important rather than winning. So congratulations to all of you, because you are winner in your zone. You have entered here after competing that zonal competition. So congratulations and all the best to all of you. Very nicely played by everyone.
Yeah.
Dr. Ramesh, you would like to add something?
Yes, sir, they have participated. That's probably that is the wonderful thing, sir. They have competed and they have answered it so nicely and so quickly. And I think rather more important than answering and getting it correct is that the process of this quiz is that you learn from every question. The stem of the question, the choices which have been framed from the question, and the way the people answer it. So it's a learning process because all the questions have been framed from their principal textbook of Harrison. So it is ultimately going to help in their day-to-day work also, and in their coming maybe entrance examinations or their as they go higher and higher, sir. So wonderful, sir.
So any feedback from the participants before we have the results? I hope there is a clear-cut result and we don't have to go further up down the tiebreaker questions. So any feedback from all of you? You are all tense. You should enjoy the quiz. It has been a learning experience. I think this is an experience which is important. The result is not that important. I think there are two winners which have to be allocated out of you. So the first and the runners up. And but participation certificates would be given to all of you. And that is what we had decided earlier also. And I'm sure that this is just an event for all of you, and you will have many more events to come. Maybe not in this form, but yes, paper presentations, posters, and many lectures in future also. So these are launch pads for your future growth and success. So we will wish you all the best and a great successful career. And I, with Dr. Shubhlakshmi, Dr. Ramesh, Dr. Ghanshyam, and the uh, jury members, Dr. Sudarshan, Dr. Muruganathan, we would definitely look forward to meet you in person in one conference or the other some way during our lifetime. Let us hope so. So all the best to you all. Dr. Manjula will facilitate your meeting with all of us.
Yeah,
Maybe
yeah,
in
I
the
will
next we can
definitely.
invite them to the next fever conference next year.
Yes, sir. Or in between, if there is a program, we can plan something, sir.
Yes, definitely.
Right. So they're compiling and they're going to share with us in another few minutes. If
No issues.
Gansham sir is not there, so you can
Now, boy, he
ask
must
them.
have they got disconnected because of the flight issues.
So we have a participation from all over the India, sir. Dr. Naveen is from Jaipur. Dr. Aditi is from Maulana. Dr. Aman is from Bhopal. So this is North India, I believe. Dr. Madhurima is from Assam. Dr. Sai Prasad is from Wardha. Dr. Siddharth is from Bangalore. Dr. Tanvi from Assam. So we have two candidates from Assam this time, Dr. Madhurima and Dr. Tanvi. Am I right?
Two participants from each zone. So both are from that side.
Right. So they are from the same medical college. You are muted, Dr. Tanvi.
No, we are not from the same college, sir.
So Dr. Tanvi is from which medical college?
Assam Medical College. It's in Dibrugarh.
Okay. And Dr. Madhurima is from?
The Silchar Medical College, Silchar.
Okay, right. And Dr. Vishnu is from
Ramesh, you are going to be in Guwahati. You can meet them next week.
Yeah, that's why I was asking whether the place where we are going, are we going to meet them and personally facilitate them? Yeah, that's what I was asking, sir. Okay.
Dr. Shubhlakshmi would be in a better position to visit Dibrugarh or Silchar. She is there for a couple of days. You are
Yeah,
hardly there for 12 hours.
Yes, sir, I will be there.
Over the weekend.
Lakshmi, you are from GMC?
Yes, sir.
Yeah, so Dr. Aman is also from GNC Metalhead.
He is Metalhead.
Yeah.
I just Sai Prasant want to drink a cup water and come. You can. He can go and
Sure,
we can come now,
now
sir.
there is no
Yes,
compulsion of putting the video or the.
No, let them. We
Then we
can see
already
them.
had a water bottle
But
by
then
her
he
side.
can have. He was asking. I just saw his message now.
And definitely. Now there is no compulsion. Yeah, be informal. You can. I was asking for their comments if they want to say anything, because this has been an experience for them
Yeah.
participating online earlier and in this. So
So
you
they,
are.
how many of you must have got bonus marks, and whom do you think would have? You only know would have won. They will only know because everything was open, right, sir? Because we don't know
They
the
might
rapid
be
fire
calculate.
only. Yeah, only the
Yeah.
rapid fire. We won't know who was first. Otherwise, general round we would know actually.
Actually, they will tell us the score.
Yeah, you can tell us the score. I can cross check. Actually, if you tell, I will cross check. Naveen, leave the rapid fire, sir. Can I ask with the permission of Anupam, sir? Can I ask them?
Sure,
So
please.
when it comes, so we can cross check. So we will be very transparent in that way.
But they will actually not. They had access to who answered first. I don't think.
No, sir. We in the bonus round, everyone who except the rapid
Bonus round
fire,
they would know. Yes.
rapid
Yes,
fire,
yes,
we
yes.
will wait. Others, it should be ready, right, sir? Others,
Yes,
I
yes,
will.
yes.
There was an issue with that only.
No
Naveen,
issues. No issues.
apart from the last rapid fire, how much you have got according to you? How many bonus marks you would have got? Anyway, they have the tabulation in the chat box.
In
We can
first
show.
and second, including first and second round, ma'am.
Correct. Correct. Yes.
Ma'am, I think 2 or 3. I
Correct
guess
answers you have.
this thing.
Right to
Yes.
do. What about Aditi? You would have got some
Ma'am,
bonus marks, you think, Aditi?
ma'am, 2 or 3 only here.
Yeah, okay. Aman?
Yeah, same. I feel as I would have
Same,
got
is it?
yes,
Yeah.
ma'am.
Madhurima?
Madhurima.
Yes, ma'am. I for me like that, ma'am.
Same,
Yes,
is
ma'am.
it? Yeah. Sai Prashant? Prasad, sorry.
I guess 2 from the first round and 2 from the second round. So mostly
Four, is it? Yeah. Let them check. Siddharth?
I lost count, ma'am. I think 2 or 3.
Yeah, okay. Tanvi?
Same, ma'am, 2 or 3.
2 or 3. Vishnu?
I think 2, ma'am.
2, is it? Okay. So that means they're all going neck and neck in first 2 rounds, na, sir? 2 or 3 means like additional. So it's a rapid fire round. I think that is the decider, according to me.
In the first round, there were 2 questions which went unanswered. In the second also, I think 2 questions.
First round, sir, Aditi did not get it right, and Madhumita did not get it right in round. And Vishnu, you got it right in the first round? No, he got it wrong actually, Vishnu, first round. First round direct question I'm asking.
B, F,
Right?
and H. Yes, B, F, and H were not
Did
answered
not
in the
get.
first round.
In
Yes.
the, yeah, correct. Second round again, Aditi
B
and Aman.
and E were not answered.
Aditi did not get it right. Aman, you also did not get it right, I think, no? Second round, you missed it, correct? And then what about Tanvi? Actually, she didn't get it. She knew later on. She realized the answer, but she lost it, right? And Vishnu, what about you? Second round also, you did not get it right, right? Yeah. So that means my scoring is pakka. That I made sure that whatever I have written is correct. Now it's
So we
bonus
do not know
because I
about the
have no
pass on marks and the rapid fire.
exactly. I have no access to that. So RX event has to tell us
Let them pass the Excel on to you. Yes.
Exactly.
Yes.
RX event, are you ready to send? Have you sent me?
Yes, ma'am. Just a second.
How are you sending?
Just a 1 second. We'll share.
What are you sharing? What are you sharing, RX event? What is this you are sharing?
Cumulative result.
Wrong. I think wrong. You recheck now once. Because this is the rapid fire round or all together. How are you sharing?
Dr. Manjula, these are all together.
Sir, it can't be, na, sir. Something they've.
नहीं नहीं ठीक है.
हाँ ठीक है sir.
ठीक है.
Recheck now once. Because according to them, they have answered 2, 3 correctly, means they should get the bonus of marks. If that is true.
That he has to check.
That's what I'm saying. Check the right. See, direct answer don't show us. Please check in the chat box. Then it is not correct.
Madam, I think I got 2 passing question in first round and 2 in second round. So the total should be 40.
Yours. So you got correct. 5 additional you are saying.
Yes.
2 question 10 plus 10 plus direct 2 40 you are saying.
Yes.
How much did they show?
35.
Please check. No, please don't go by fastest. Give bonus to all the. I'm talking only in the first 2 rounds, not in the rapid fire. Rapid fire you should give only and only the fastest finger only. Please, yes, you are there. Kindly check, please.
Manjula, what we can do is you can get the snapshot of the chat box from them, so that then you can get it computed at your level.
Yeah, can you just send us the screenshot of this? Yeah.
चैट बॉक्स का जो है ना प्रिंट आउट आप या जो है ना उसके स्नैपशॉट सीक्वेंशियली सेंड इट टू डॉक्टर मंजुला.
Yes sir, अनुपम sir, 1-2 मिनट.
उससे जो है ना फिर then she will be able to calculate. तो मतलब we can defer the result maybe half an hour, but that will at least have clarity. Dr. Ramesh, Dr. Shubhlakshmi, is that okay now?
Yes sir.
Yes sir, definitely sir, definitely.
I think some programming has gone wrong. They are getting it all wrong. They have to do now manually.
Dr. Ramesh already said that the manually is the best.
Yeah. Some wrong coding. Yeah, one bug here and there, then whole system goes
Programming can go haywire, but
yeah.
Yes, whatever is the manual, you can just check and do it.
Exactly.
And then it would
Please
be,
check manually and tell us.
that
Go
would be the
question
best.
by question.
Yes.
You may take little more time. That's fine. Please, but tell us the correct answer. And
Tapasya, sir, it's like a waiting is always good. There is no harm in it. Everybody is anxiously waiting. It makes the thing even
Everybody should
more.
not be anxious. Everybody should relax.
Yeah, they are relaxed.
anyway.
Yeah, they are all happy.
You
and
can
they are-
log in through your mobiles. All of you can log in through your mobiles and keep your desktop off now, so that you don't have any compulsion of being seated out here. It should not be a punishment or anxiety for you people. Now there is no compulsion to keep your audio or video on or off, whatever. So that I think that will make you more free. You can log in through your mobile, so you will come to know. And anyways, Dr. Manjula will contact the winners even if you by chance are not able to log in back.
Sir, I've asked them to send the screenshot of every round ka chat box, so that to be fair, I will cross check their
That
numbers.
will be the best.
Yeah, so that we are fair, and may the best person who did well will win. I will share the same to you also, sir, so that there is no issue.
So do we retain them here, or would
Yeah, can
you
we
will?
stop live? I think, right? We can, all of them can be there. This live can be stopped, or how do we say, sir?
So